Did you know pancreatic cancer is one of the deadliest cancers in the world? It often hides silently, showing no clear signs until it's too late. And here's the most alarming part. Over 60% of cases are found in people over 65. But what if I told you the earliest warning signs can appear months before diagnosis? Signs many seniors mistake for nothing more than just getting older. Today, we're breaking down 6 deadly symptoms of pancreatic cancer that you must never ignore. Spotting even one early could mean the difference between life and death. Stay with me until the end because I'll also share how you can lower your risk and protect your pancreas starting today. Why pancreatic cancer is so dangerous. The pancreas is a small organ hidden deep in your abdomen, behind your stomach. It's responsible for producing digestive enzymes and regulating blood sugar through insulin. The danger? Its location makes tumors hard to detect during routine exams, and symptoms often appear only when the disease is advanced. This is why pancreatic cancer has a 5-year survival rate of less than 12%. But the earlier it's found, the higher your chances of survival. And that's why knowing these warning signs is so critical. Symptom 1. Jaundice, yellow skin or eyes. One of the most alarming early signs of pancreatic cancer is jaundice, a yellowing of the skin or the whites of your eyes. It may start subtly, with friends noticing before you do. Alongside this, you might see dark, tea-colored urine, pale or greasy stools, or even persistent itching that seems to have no cause. This happens because the pancreas sits close to the bile duct. When a tumor develops, it can press against or block this duct. As a result, bile, a yellowish fluid that helps digest fats, can't flow normally into your intestines. Instead, it builds up in your bloodstream, causing that yellow discoloration and the other symptoms mentioned. Jaundice is not always painful, which is why some people delay getting it checked. But here's the urgent truth. In pancreatic cancer, jaundice often appears before severe pain or weight loss. That means it could be one of your body's earliest SOS signals, giving you a narrow window for early diagnosis. If you or a loved one notice even mild yellowing, don't dismiss it as liver trouble or just aging skin. Get tested immediately because acting fast could save your life. Symptom 2. Pain in the upper abdomen or back. Another critical warning sign of pancreatic cancer is a persistent, dull ache in the upper abdomen that often radiates straight through to the middle of your back. You might notice it more after eating a meal or when lying down at night. Sometimes the pain eases slightly when you sit forward, but it never truly goes away. This pain occurs because the pancreas is located deep in the abdomen near major nerves and organs. When a tumor grows, it can press against these nerves or the spine, sending discomfort both forward into your belly and backward into your back. Here's the dangerous part. Many seniors brush this off as just back problems, arthritis, or even indigestion. This assumption can delay diagnosis for months, giving the cancer time to spread. If you've had new, unexplained upper belly or back pain for more than a few weeks, especially if it's worse after meals or at night, don't ignore it. A simple medical checkup, imaging scan, or blood test could reveal the real cause. In pancreatic cancer, catching it early is everything, and this pain could be your body's way of sounding the alarm. Symptom 3. Unexplained weight loss and loss of appetite. If your clothes are getting loose without dieting, or you're eating far less than usual because you feel full quickly, it's time to pay attention. Unexplained weight loss and a sudden drop in appetite are common early signs of pancreatic cancer, and they often appear months before a diagnosis. This happens because pancreatic cancer disrupts your body's metabolism, making it burn calories faster than normal. At the same time, the tumor can block the release of digestive enzymes, making it harder for your body to break down and absorb nutrients from food. As a result, even if you're eating, your body may not be getting the fuel it needs. Many seniors mistake this for just getting older or blame it on stress, dental problems, or a change in taste. But rapid, unexplained weight loss is never normal, especially when paired with reduced appetite or early fullness after small meals. If you notice these changes, even without pain, see your doctor immediately. Simple blood tests or imaging can rule out serious issues. In pancreatic cancer, catching these subtle signs early can make all the difference in treatment options and survival. Symptom 4. Digestive problems. Persistent digestive troubles, especially when they appear out of nowhere, can be a silent warning sign of pancreatic cancer. Watch for bloating, frequent nausea, indigestion that doesn't improve with medication, diarrhea, or greasy, foul-smelling stools that float in the toilet. These symptoms happen because the pancreas plays a vital role in digestion, releasing enzymes that help break down fats and proteins. When a tumor blocks the pancreatic ducts or disrupts enzyme production, your body can't properly digest food. This leads to undigested fats passing through your system, causing oily or greasy stools, excessive gas, and discomfort after eating. The danger is that many seniors write these symptoms off as a sensitive stomach, food intolerance, or the side effects of aging. Unfortunately, this can delay detection until the cancer has progressed. If you have ongoing digestive problems lasting more than a couple of weeks, especially if they are new, worsening, or combined with weight loss or jaundice, see your doctor without delay. Treating the root cause early could save your life, and in the case of pancreatic cancer, time truly matters. Symptom 5. New onset or worsening diabetes. If you've never had diabetes but suddenly develop high blood sugar, or if your existing diabetes becomes much harder to control, it could be more than just a routine change in health. New onset or worsening diabetes is sometimes an early clue to pancreatic cancer, especially in seniors. Here's why. The pancreas produces insulin, the hormone that regulates blood sugar. When cancer cells grow in the pancreas, they can damage the insulin-producing cells or interfere with their function. This disruption causes blood sugar levels to rise unexpectedly, even in people with no history of diabetes. For some, this might mean suddenly needing diabetes medication or insulin injections. For others, it could be higher than normal readings during a routine blood test. Sadly, this red flag is often overlooked because doctors and patients may focus only on treating the blood sugar without investigating the cause. If you're over 60 and develop diabetes for the first time, or if your stable diabetes suddenly worsens, don't ignore it. Ask your doctor to look deeper because in some cases, controlling the blood sugar alone is not enough. Finding the underlying reason early could save your life. Symptom 6. Unexplained blood clots. If you notice sudden swelling, redness, warmth, and pain in your leg, it could be a sign of a deep vein thrombosis, DVT, a blood clot in a deep vein. Even more alarming, if you experience sudden chest pain, rapid heartbeat, or shortness of breath, it could indicate a pulmonary embolism when a clot travels to the lungs. While blood clots can result from immobility, injury, or certain medications, in some cases, they appear for no obvious reason, and this can be an early warning sign of pancreatic cancer. That's because cancer can make your blood stickier, increasing the likelihood of clot formation. Tumors can release chemicals that alter clotting, sometimes making clots the very first noticeable symptom of the disease. The danger is that many people treat the clot but never investigate why it happened in the first place. In seniors, especially those without recent surgery, long travel, or other common clot risks, a sudden unexplained clot should be taken seriously. If you develop a clot without a clear cause, ask your doctor for a full evaluation, including checking the pancreas. Acting on this early warning could lead to a life-saving diagnosis. Why seniors should not ignore these signs. Pancreatic cancer is one of the fastest spreading cancers, and it often advances silently before obvious symptoms appear. The signs we've discussed, even when they seem mild, can signal something far more serious than common aging problems. For seniors, dismissing them as nothing to worry about can be dangerous. Here's the reality. When pancreatic cancer is caught in its earliest stages, survival chances can be up to 5 times higher compared to late detection. That's why acting on these warning signs immediately is so important. Every week, even every day, matters. If you notice jaundice, unexplained pain, sudden weight loss, digestive changes, new onset diabetes, or unexplained blood clots, don't wait. Talk to your doctor, request further testing, and push for answers. Early awareness isn't just knowledge. It's your best defense against the disease that doesn't wait. If you notice any of these symptoms, even just one, don't wait. Make an appointment with your doctor right away. Be specific about what you're experiencing and ask for further investigation if needed. This could include blood tests, ultrasound, or a CT scan to check your pancreas and surrounding areas. Remember, not all of these signs mean cancer, but each of them points to something that needs attention. Ignoring them could mean missing a critical window for early treatment when survival chances are much higher. Your body has a way of sending signals when something's wrong. Listen to it, trust it, act on it. Spotting these signs early could save your life or the life of someone you care about deeply.